Good day, I am Dr. John Anthony P. Duenas. Just call me Doc J. I am a assistant professor at Fatima University Medical Center in the Department of Internal Medicine. So I would like to welcome each one dito sa aming mga videos na gagawin about physical examination. Good afternoon po. Ako po si Dr. John Duenas, no? Ako po yung attending doctor nyo. Examinin po natin kayo ngayon. So now we will get your blood pressure, Philip. So this is the BP apparatus. So what are the different parts of the BP apparatus? So this is the aneroid Sphygmomanometer. So we have our BP cuff, which is supposed to be should be properly fit, no? And then inside the cuff is an inflatable bladder. And then we have here the manometer. Okay, and we have the inflation bulb and the valve. No? Okay, and of course we're going to use also a stethoscope to get your BP. So these are the parts of the stethoscope. This is the earpiece. This is the binaurals, and then the tubing. And then we have your diaphragm and your bed. Okay, so we will start getting the blood pressure now. So if you're going to look at the sphygmomanometer, there is an indicator written. There is an artery. So you have to place this in the on top of the brachial artery. So the brachial artery, for us to be guided, it is at the side of the small finger. So we place the BP cuff 1 inch or 2.5 centimeter above the antecubital fossa, and then we close it, and it should be snugly fit, not too tight, not too loose. Okay, and then before we get the blood pressure using our stethoscope, we first get the palpatory systolic blood pressure. Okay, so how do we get the palpatory systolic pressure? So make sure that the manometer is visible to you, and make sure that the meter is in zero. Okay, the first thing to do is to palpate the radial artery. So if the brachial artery is on the side of the small finger, the radial artery is on the side of the thumb. So we palpate the radial artery, okay, and then we slowly inflate, and then feel for the radial pulse until the time that the pulse disappear. Okay, and then once the pulse disappear, you increase the cuff more to 30 millimeter mercury higher than the time that the pulse disappear, and then slowly deflate until you feel the return of the radial pulse, and that return is your palpatory systolic blood pressure. Okay, so this is how you do it. So palpate. Okay, so it's gone. So we increase it to 30. So 120 plus 30 is 150. Okay, and then we start to deflate. And then feel for the first time that the radial artery pulse return. So it's 120. And then we completely deflate. So the palpatory systolic blood pressure is 120 millimeter mercury. Okay?